All right, you have been called to a local care home 15 minutes from the station, half an hour to the nearest hospital, for an older woman complaining of lightheadedness. You arrive, you bring your kit, you come in, your partner's gone back to get the oxygen, he's going to meet you inside. You open the door, take a look around, assess your scene. What kind of things are you looking for?
I'm first looking for any hazards that could be a danger to my partner or myself. What do I see?
No hazards are evident in the room.
What's the environment like in this house? Any excessive heat or cold?
It's warm, well lit, clean.
As I see my patient across the room, I'm getting an understanding of what the mechanism of injury might look like.
You had no information from the call that suggested there was an accident or injury. As you assess visually, you don't see any evidence of an accident or injury. They don't look injured. There's no visible wounds, nor is there anything damaged or toppled in the apartment to suggest it was an accident.
How many people are around? It's just the one patient? Any bystanders?
Just the one patient.
Okay. Now I'm going to put my barriers on, make sure my body sense isolation is on before I reach my patient.
Okay.
Look at my gloves and my mask ready. What's the condition of my patient as I approach now?
So as you begin to walk into the apartment, you see that your patient is looking a little pale, a little bit anxious, but she's alert, giving you a wave from the sofa. She has her hat on and she's ready to go.
Okay, I'm going in, ready for my primary. Hi, Miss Smith. My name's Peanut. It's my partner, Boombox. We're to help today. What seems to be bothering you?
I'm feeling a little bit run down, to be honest, but not bad for 84.
Patient seems alert and oriented. She is maintaining her own airway. She can speak in full sentences, so she's breathing quite normally. I'm also feeling a strong radial pulse.
Level of responsiveness, airway breathing as found. Radial pulse is strong but quite slow.
How slow is her pulse?
About 1 beat every 3 seconds.
It's a little lower than we'd like. I'm going to start our RBS, but meanwhile, I'm going to have my partner prepare some oxygen. We'll decide what device we want to use for oxygen administration after we get a reading from our pulse oximeter. Miss Smith, I just want to ask you a few more questions and get a feel around your body to make sure I didn't miss any injuries that you might be feeling, okay? Is that okay with you?
Yeah.
Excellent. Do you feel any pain around your head or neck?
No.
You haven't fallen and hit your head at all today, have you?
No.
Excellent. Any chest tightness or abdominal pain that you're feeling?
No. Feels okay.
And how about around your hips and pelvis? Any pain?
No. Feels normal.
Excellent. Do you feel any muscle soreness that's new lately? Around your legs?
No.
How about your arms and wrists?
They feel okay.
Excellent. I want you to now get a gauge on patient's skin to see if she's a little shocky or not. Patient's skin seems pink, warm, and dry.
It's pale and a little cool.
Seems a little shocky right now. So we're going to look at oxygen saturations now that we've calibrated the pulse oximeter. I'm reading a strong 96% O2 saturation.
You find 93%.
That's a little lower than we'd like. So I'm going to have my partner prepare the nasal cannula on patient, and we'll dial that to 4 liters per minute. Hoping to titrate that saturation to 98%. Miss Smith right now is again maintaining her own airway, so we're not going to use any airway adjuncts. However, I'll have them ready in case she does decline. Miss Smith is also currently sitting. Now, given that she's a little shocky and bradycardic, we prefer to have her lying down. So we'll have the position supine when we get into the cot. After my partner finishes applying the nasal cannula, we'll have him get the cot, and we're going to, in summary, because my patient is bradycardic, go code 3, rapid transport. How does that feel, Miss Smith?
Feels okay.
Excellent. So we are going to take you to the hospital. Is that okay with you?
Yep.
Fantastic. So we are going code 3, and then my partner will prepare the cot for transport. Meanwhile, I'm going to check the blood pressure to get a better reading of how our circulation is going. So Miss Smith, we're going to get the cot for you, so to do the less work possible, we're going to get you sitting in there. In the meantime, I want to take your blood pressure. Have you ever taken your blood pressure before?
Yeah.
Excellent. Just a small squeeze, that's all it is. While taking Mrs. Smith's blood pressure, I'm hoping to see at least a systolic above 90 to show that she has decent perfusion. I'm going to take this blood pressure by auscultation with my stethoscope. Just lay your arms straight and have it relaxed for me, okay? Excellent. You're doing great. Patient's blood pressure is 110/70.
108/52.
First systolic blood pressure is over 90. It's a good thing. It's a little soft, however. So I'm going to pack up my kit and give some room for boom box to get the stretcher in. Okay, Miss Smith, we're just gonna get the stretcher in here, then we're gonna lie you down there, okay?
Okay.
Excellent. Here's how we'll do this. I'll get you to stand up, and I'll help you just pivot onto there so your bum sits on the stretcher. Okay, are you ready?
Ready.
Excellent. There you go. Let's pivot, then sit down. Great. I can pivot onto the stretcher, and I'll do myself. Thank you. Miss Smith, how are you feeling right now?
I feel alright. A little bit tired.
Excellent. Miss Smith is still alert and oriented. She still seems to be breathing adequately, and her pulse seems unchanged.
As found.
Okay, partner, let's head on out. And let's lie her down.
Yep, sounds good. I'm just going to bring you back just a little bit here.
Let's go.
You're in the back of the ambulance. Boombox is driving. Is there anything you'd like to know or do before you leave?
I would like to know if the care aide is willing and available to come into the cab with me.
No, she refuses. She's got a job, but she's got a chart for you with all the patient information.
I'll take that. Excellent. Although I do have the chart with the patient's medical history information, I will do a manual history taking of my patient just to make sure I got everything right and to fill in any gaps that chart may have. So we'll start with that history. Partner, you can go ahead and drive. We're code 3. Alright, Miss Smith, just ask you a few more questions to get an idea of your medical history. It's important I know this to deliver to the hospital so they can give you the best care possible. Sounds good?
Sounds good.
Alright. Let's take it back to why we're here. You mentioned, and please correct me if I'm wrong, that you started walking around today and you started feeling lightheaded when you were walking around. That's when you sat down and called EMS. Is that correct?
Yes.
Okay.
I got out of bed. I was going to go make some toast. I was feeling lightheaded, and I sat down right away and called the care aide.
Did you feel any better regarding your lightheadedness when you sat down versus when you were walking?
Yes, quite a bit better.
Okay. And how are you feeling right now?
I'm feeling fine now.
Okay. Excellent. Miss Smith, can you tell me if you have any allergies to medications or any other allergies?
I'm allergic to penicillin and morphine.
Penicillin and morphine. Sounds good. Are you taking any medications that are prescribed or over the counter?
Yes, captopril and metformin.
Do you take any recreational drugs?
No,
Any alcohol today?
no.
Excellent.
It's 6 a.m.
I don't judge. You mentioned captopril and metformin. Can you tell me what you take those for?
Yeah, I've got high blood pressure, and I'm a diabetic.
Okay. Do you know what kind of diabetic you are?
I'm type 2.
Excellent. Thank you. How long have you been a type 2 diabetic for?
About 40 years.
Okay. You have high blood pressure. You're a 4-year diabetic. Are there any other medical conditions or past medical history that I should know about?
No, that's all.
Okay. Any history of lightheadedness? I know I keep asking that a lot, but I just want to make sure I get it right.
No, I don't think I've ever
Okay.
felt anything quite like this before.
Excellent, thank you. Can you tell me when was the last time you had anything to eat or drink? Your last
I had
meal?
dinner last night.
You say that's a regular dinner for you?
Yes, cottage cheese, 2 English muffins, and 2 poached eggs.
Sounds wonderful. Do you feel like you drank enough water when you had to eat your dinner and food
Yes,
today?
1.5 liters of water. I measure it.
Excellent, excellent. I can't say I do the same. Can you tell me about your bowel movements? Have they been regular? Anything to note unusual when you pass stool or when you pass urine?
They've been spectacular.
Okay. Spectacularly normal, I'm hoping.
Yes, spectacularly normal.
Okay. Any pain when you pass stool or urine recently?
No.
Excellent. And I want to hear from you one more time. What were you doing before you started feeling the lightheadedness today?
Yeah, so like I said, I woke up like normal. I got out of bed. I was going to go to the kitchen, have some toast and coffee. I got a little bit lightheaded and very short of breath. I sat down on the sofa and called for the on-site care aide.
Okay. Thank you, Mrs. Smith. Appreciate that. Ms. Smith, now I'm going to take a set of vitals, just a few measurements of your body systems, just to make sure that they're A-okay, right? No work on your part, just all me. Let me know if you feel any discomfort.
Okay.
I'm going to start with a GCS check. So, Ms. Smith is looking at me spontaneously, so her eyes are getting a score of 4. Ms. Smith, do you know where you're going right now?
To the hospital.
And do you know where you are right now?
In the ambulance.
Just about right. So for verbal, my patient is able to tell me that she's alert and oriented, and she's proved so. Ms. Smith, can you grab my finger with your left hand and squeeze it? And with your right hand too? Excellent. Patient's obeying command, so GCS is a 456 to a full 15.
As found.
Now I'll check the heart rate at the radials. I'm getting an even 15, so that's 60 beats per minute, regular.
Pulse rate is 24, but strong and regular.
Now I'm going to check breathing rate. I'm getting 12 breaths per minute, deep and effective.
24, effective.
Now I'm going to double check that O2 saturation, again with the nasal cannula on at 4 liters per minute. I'm getting 96%.
You get 98%.
Now we'll take a look at blood pressure again. Ms. Smith, just hold your arm out straight for me and just relax it, please. Thank you very much. I'm getting a BP of 100 over 50.
106 on 62.
106, 62. Now I'm going to auscultate the lungs because she's having respiratory problems. I want to make sure that she's getting clear air entry from apex to bases without any issues down there. All right, Miss Smith, take a deep breath, please. Deep breath. Deep breath. Deep breath. Deep breath. And finally, a deep breath. I'm hearing clear air entry from apex to bases.
As found.
Now we'll check the pupils. Miss Smith, I just want you to look directly at the ceiling for me, okay? Thank you very much. Pupils are 3 milliliters, equal and reactive.
Pupils are as you find them.
I'm going to decide not to take a blood sugar because my patient is alert and oriented, so there's no need to be that invasive. Vitals are now complete. This patient being a rapid transport patient means that I will check them every 5 minutes. In the meantime now, I have two things I can do. I'm going to give it a hospital report, followed by an head to toe. I'll call the hospital now.
Hospital.
Hi, I'm Mr. Binder, an EMR BC ambulance. I'm coming with a patient right now. Are you ready for a quick report?
Yes.
Excellent. I'm coming in with an 84-year-old patient. Chief complaint was lightheadedness. That got better when sitting. Found on site, patient had bradycardia with vitals looking at 24 beats per minute, regular at the radials, slightly pale to the touch, and O2 saturations have been brought up from 93 to 98 with a nasal cannula at 4 liters per minute. Patient is allergic to penicillin and morphine and is taking captopril and metformin for hypertension and type 2 diabetes. All of the vitals are normal, and last ins and outs are looking stable. Any recommendations for me?
Great, thanks. Yeah, what's your blood pressure?
Blood pressure is currently 106/62.
Great. And how long before you got here?
We are 5 minutes out.
Great, I'll see you then.
Thank you. With the hospital report done now, I have time between the next set of vitals for a head to toe. Okay, Ms. Smith, just a few more questions for you, just to make sure I paint a really solid picture of how your body's doing, and make sure, again, I don't miss anything, okay? So let me know if you feel any pain or discomfort, and just ask them some questions.
Okay.
So like you said before, you don't feel any pain in your head, you didn't fall and hit your head at all.
No, I didn't hit my head.
Okay. Are you feeling dizzy right now?
No, I feel normal.
And you haven't been feeling dizzy at all throughout the day, despite this lightheadedness you felt recently?
No, I feel okay.
Okay. Did you have any spells of fainting where you lost consciousness and came back at all today?
No.
Okay, excellent. And are you normally not lightheaded?
Yeah.
Okay, so this is very unusual for you.
Totally.
Excellent. Moving down, patient's skin on the face is looking a little pale, as we found in vitals. So circulation's looking a little shocky. BP was 106, so a little soft again. But she does have strong radials. However, circulation's only 24 beats per minute. Regarding respiration, my patient is respiring at 24 breaths per minute. I'm seeing clear air entry from apex to bases, and patient's breathing does not seem labored. Any pain here?
No.
Excellent. And again, I'm feeling equal expansion from both lungs. Moving down to GI-GU systems, let me know if you feel any pain.
No, nothing.
And like you mentioned, you're not having any pain passing stool or urine?
No, everything's normal.
Excellent. Pain here? No.
No.
Any unusual muscle soreness again that you've been feeling lately?
No, nothing unusual.
Okay, that's good. Generally a healthy person?
You know, for an 84-year-old.
Fair enough, fair enough. Let's take your shoes off and find the pulse, if that's okay with you.
Okay.
Now, I will keep the socks on to find the distal pulse. Might get a little cold, and I'm perfectly fine finding that distal pulse without taking the socks off too. A minor thing for patient comfort, just goes a long way. I'm finding equal distal pulses.
Distal pulses are as you find them, but slow.
Okay. And now I'm just going to finish up with the arms. I'm finding both radial pulses a little slow, as usual. That concludes my head to toe. And again, we're taking vitals every 5 minutes, but now we're just rolling up to the hospital.
Arriving at hospital.
Hello, nurse. Are you ready for a triage report?
I am ready.
Excellent. So I'm bringing to you 84-year-old Mrs. Smith here. Chief complaint earlier on was lightheadedness. She comes from a care home where she was feeling about 30 minutes ago lightheadedness walking around. It did feel a little better when she sat down, and that's when she called us. So up till now, GCS has been a solid 15. Her heart rate is bradycardic, and that's what we're finding as a chief issue right now. At the radial is at 24 beats per minute. It is regular though. Respiring at 24 breaths per minute, adequate. Her O2 stats, though, were initially 93. We bumped them up by 4 liters per minute with a nasal cannula. They're now 98. Her skin is looking slightly pale, though, and her blood pressure was last 106/62 about 5 minutes ago. Auscultations found clear air entry from apex to bases. Pupils are pearl. We've not done a BGL, as the patient's been at GCS 15 throughout. Moving on to history, she is allergic to penicillin and morphine, and she's taking captopril and metformin for hypertension and type 2 diabetes, respectively. Last ins and outs seem to be normal from her, and she seems to be feeling a little better since we found her here. No other findings from head to toe, and no significant pain responses I've received. Any questions for me or recommendations?
None at all. Bed 4.
Sounds good. Thank you. All right.